Dr. Brent Wallis joins us now, our friend Dr. B, Chief Medical Officer at People's Health. Good morning, Doc. How are you?
Good morning, Tommy. I'm doing well.
I appreciate your time. I really do. I think a lot of times we do just perhaps have to just settle down, take a breath.
Yeah, definitely, especially during this time. I think it's real important.
Why is it so important to maintain your health during times like these?
Well, I think right now, people are so focused on the pandemic that's going on around us that they may be forgetting to do other things that they would normally do. And unfortunately, some of those things are taking care of themselves with their own health issues, exercise, diet, all of those things.
When it comes to chronic conditions and some of the, underlying factors, comorbidities, whatever the expression is, it's almost like a double whammy where that puts you in maybe more danger from COVID-19, but yet that might be some of the very conditions that are being neglected while all this goes on.
Yeah, I think if you look at what's going on right now, the individuals that are getting the sickest are usually the ones who have chronic medical conditions. And unfortunately, when you're in a situation where you're being asked to stay at home, it's also going to limit your ability to take care of yourself and control those chronic medical problems. So it does create a bad situation.
If you go out, you're susceptible, so you don't go out, so you get even sicker, which makes you more susceptible, which means you don't want to go out. And that could just be a very disastrous downward spiral that would happen kind of quickly, I would think, huh?
Yeah, definitely. I think we see it all the time that, people are worried about going to emergency rooms. They're even worried about going to see their own doctors. And so they may not get their medications refilled. They definitely are not getting their blood pressures checked and their blood sugars checked in most instances. And so those diseases can definitely get out of control quickly.
I don't mean to diminish COVID-19 at all, but how can I try to make an analogy here? When it comes to those underlying conditions and seeing a doctor, and we'll talk about that in a second, you got to fly the plane, right? So while you do have to be concerned, and again, I got to be careful here, Dr. B, because I'm not trying to diminish COVID-19 at all, but you can't be so worried about the things that could affect the flight that you don't fly the plane to begin with. Does that make sense?
Yeah, definitely, and I think it's tough in this situation. COVID-19 is very sudden. The mortality is very real and it's very immediate. I think we're seeing this in the last couple of months. But I think we also have to recognize that things like heart disease and cancer are still going on. And within a 2-month period like this, we would probably identify a lot of new patients with those disorders that need treatment.
Are people avoiding a doctor right now? Are they kind of hesitant to go?
Yeah, definitely. And I think some of it is warranted. I think especially at the beginning of the pandemic, we do need to stay home. We need to limit our interaction with others. And I think the health system needed a little bit of time to establish sort of the new rules of engagement and safety in order to make it okay to go back to your doctor. And I think that's the direction that we're heading in right now.
You think maybe so much was made, and rightfully so, about the medical system being overwhelmed, that people kind of conflated that with their own doctor where it necessarily wasn't the case?
Yeah, I think so. I think the other piece that did happen is there was an LDH order that was issued, and rightfully so, that any elective type procedures needed to be delayed when possible. And that was really being done to make sure that our healthcare system did not become overwhelmed. And I think what's been good over the last couple of weeks is that LDH has relaxed that order a little bit with some modifications, which has allowed some of the practitioners to start seeing patients and actually treating these illnesses a little bit more.
So if you're a patient, don't look at it as, I don't want to bother the doctor with this. He or she is busy with COVID-19 patients, or I guess even the same thing when it comes to the ER, right? The ER can handle you right now?
Yeah, I think what's really great right now is a lot of those mitigation techniques have been successful, and I think because of what we've done as a population, we've flattened that curve and we've allowed the access that we know we need in order to be able to take care of those patients. So right now, urgent cares, ERs, and physicians, primary and specialty physicians are available and really do want to help you with your medical problems.
We're going to take a quick break. If you have any questions or comments, you can text them to 870-870, and I'll pass them along to Dr. B, Dr. Brent Wallis, who is the Chief Medical Officer of People's Health. And we're going to do this every Thursday. A lot of us have parents, well, mine are gone, but a lot of people my age have parents that are entering the Medicare years and the elder years, and they might have some health concerns or questions about caring for their elderly parents. And, some of you listening might be in that category where you have some concerns as well. So we're going to dedicate this segment to provide our seniors with the answers they need. People's Health is going to be with us every Thursday morning, along with our friend Dr. B, Dr. Brent Wallis. He sees patients. He's a VP of Clinical Integration with People's Health, and he's a boxer owner, so I know he's a good guy. 820 traffic now, WWL. 823, Tommy Tucker, WWL, talking to our friend Dr. B, Dr. Brent Wallis. He is the Chief Medical Officer for People's Health. And each day here at WWL, we get a lot of calls from senior citizens and children of senior citizens that have questions, concerns about the health care of the individual, especially in light of all of the COVID-19 pandemics and the resulting problems. A lot of them don't have access to quality information. A lot of people have questions about Medicare and everything that entails. It can get terribly confusing. So that's why we're dedicating this new segment every week, every Thursday at this time, to providing our seniors with the answers they need. We partnered with People's Health, and that's why we're talking to Dr. Brent Wallis, Dr. B, as he's otherwise known. And, Doctor, you still see patients, right?
I do.
Is that your favorite part of it?
I think I like both of it. Sometimes doing my other job, my CMO job, allows me to affect a larger group of people, and that's very refreshing as well.
Let me get to a question here that came in. How dangerous is COVID for a healthy 65-year-old with no underlying comorbidities?
I think with no underlying comorbidities, COVID is as severe for a 65-year-old as it may be for a younger individual. I think the piece you have to be careful about and why it's so important to follow all of the local, state, and CDC guidelines is that 65-year-olds may have underlying conditions that they're not aware of. So if they haven't been diagnosed with something, they could be walking around with something that they don't realize that could put them at a higher risk at this time.
Somebody else texted in here and said that their doctor is only seeing patients via tele-appointments. And we wanted to get to that as well. For people that sometimes doctor technology can be confusing and intimidating. And my technological advisor is my daughter, and she's in Natchitoches right now. So, Lord forbid something crashes or this or that or the other thing, because I'm going to freak out. But when it comes to tele-appointments and telehealth, there's no need for that, right?
Well, I think it's kind of interesting. If there's one bright spot in what all's been going on for the past couple of months, I think it is telehealth and telemedicine visits. And, I'm sure you remember after Katrina, prior to that storm, no one had ever text messaged anyone before.
That's right.
And suddenly that became our primary means of communication. And I think very similar in this situation where everyone was, very suddenly and abruptly disconnected from their healthcare provider, we needed to quickly pivot to some way that we could still maintain their health. And I really think telemedicine is an adjunct to the regular in-person appointments that you have with your doctor.
So for people that don't quite understand what that is or the way to make it as effective as an in-person appointment and to get the most out of it, can you kind of walk us through a typical teledoc or telehealth appointment?
Sure, they're very similar to in-person appointments, but obviously you're not in the doctor's office. And so the way that most of them work with your provider is you make an appointment just like you normally would. But when it comes time for your appointment, you actually utilize either a smartphone, a laptop, or a computer to set up a secure two-way communication, so an audio-video communication with your physician. And interestingly, most people have virtual waiting rooms where the medical assistant will kind of virtually room you in and ask you what your problems are, just like they would in the office. I think one of the constraints we have is that because we're not physically with you, we can't check vital signs. So we have to rely on you to let us know how you're doing. We may ask you to step on your scale if you've got one, and we hope you do. Check your blood pressure, especially if you've got a history of high blood pressure, and let us know what those are. And then the medical assistant will pass off the visit to the physician so that they can have a discussion with you.
And you also want to, I guess, just as you wouldn't have a lot of commotion going on with you when you go into the doctor's office to get the most out of it, you want to kind of make sure you're not in the middle of a circus, right? You don't want dogs barking and kids running around and Lord knows what, TV blaring in the background, because you wouldn't have that as you go into a doctor's office to have an appointment.
Definitely, and we do see that sometimes. An occasional dog runs by the computer, but we do, we ask, and a lot of the support staff in the clinic actually will prepare you for the visit. Help you choose a room in your house that's quiet so that you can have a meaningful conversation. Lighting is extremely important. A whole lot of physical medicine, that we do is observation. And so seeing how a person is reacting, seeing their facial expressions, seeing how they move. We may even ask you to stand up and turn around, move your arms. A lot of information can be gleaned from that. So we need you to be in a place where you can kind of move around a little bit and we can see you really well.
Doctor, I appreciate your time. I really do. And we'll talk to you next Thursday, if not before. Have a great week.
Sounds great. You too.